I see this question asked a lot. What's the difference between a midwife and a doula? Maybe you're thinking of hiring one or the other or both and want to fully understand where they overlap and where they don't. I'll be covering all of that in today's video, so keep watching. Hi, I'm Ashley and I'm a doula, a birth photographer, and a childbirth educator in the Greater Toronto Area, and I'm extremely passionate about informed and empowered birth. Make sure you subscribe to my channel so you don't miss any tips, tricks, and advice to birth and parent like a boss. Before I get into the details of what makes a doula different from a midwife, I wanted to mention that what I'll be sharing pertains primarily to Canadian residents due to the healthcare system we have here, but I will make a note of any differences with what might be expected in the US. So let's get started. This is one of my favorite topics because there still seems to be so much confusion about what the difference is. And no, doula is not just another term for midwife. The primary difference is actually in the focus of care. Midwives are medical professionals and they cover everything on the clinical side of your pregnancy and birth. So, for example, during pregnancy, your midwife will do things like ordering tests, checking your blood pressure, and using the fetal Doppler to check your baby's heart rate. During birth, their primary focus is on making sure that you and your baby are safe. So they'll be monitoring both of you for signs of any issues, doing cervical checks, doing any vital checks, and giving you antibiotics if needed. They basically do everything that you would expect both a nurse and an OB to do, just like any other healthcare provider. Doulas, on the other hand, provide emotional, physical, and informational support to the birther and their partner, but do not perform any clinical tasks such as diagnosing, doing cervical or blood pressure checks, or fetal heart rate checks. We don't do any of that. Our sole focus is on supporting the family through an extremely pivotal moment, staying by your side throughout your birth, helping with comfort measures, supporting your partner in supporting you, and helping you make informed decisions about your care. That's not to say that midwives don't also provide emotional, physical, and informational support, because they can and they do. But I do want to be clear that a midwife's responsibility is on the safety of you and your baby, while a doula's responsibility is supporting and holding space and helping to facilitate the best birth experience possible for you. Now let's talk money. And this is where I'm going to get specific to Canada, because midwives here are covered by the provincial healthcare systems, which means that there is no out-of-pocket expense, just like with an obstetrician or your family doctor. I want to repeat that. Midwives are 100% covered within the provincial healthcare systems, and you do not need to pay out of pocket to have a midwife as your primary healthcare provider. Doulas, on the other hand, are not covered. Some insurance companies may cover the expense of a doula under your employment insurance benefits, so it's definitely something that you might want to look into, but for the most part, doulas are an out-of-pocket expense. That's why many doulas offer payment plans or even registry options so friends and family can help to offset the cost of birth support. In the US, on the other hand, both would be out-of-pocket expenses, so not really a point of difference here. However, you'd have to check with your insurer to see whether either are covered by your insurance. The last point of difference I wanted to mention between midwives and doulas is regulation and education. Midwives are a regulated profession in Canada, which is precisely why they're covered by the healthcare systems. And every midwife must complete an intensive 4-year bachelor's degree and placement for hands-on experience before becoming a registered midwife. They are specially trained to handle any emergency that can arise during birth, including resuscitation and hemorrhage. And they are also, this is pretty neat, the only healthcare providers that have the privilege of attending home births. Doulas are not yet regulated in Canada, And there can be variations between the training programs that are available to doulas. In fact, certification is not actually a requirement to be a practicing doula, so if that is something that is important to you, definitely don't be afraid to ask any potential doulas about their background, their training, and also their continuing education, because that is sometimes just as important as their doula certification training. Now, lack of regulation might sound a bit sketchy, but it's actually a good thing in many respects, because it allows us the freedom to fulfill our roles in a way that we wouldn't be able to if we were regulated, because, well, we'd be filling out a bunch of paperwork right there beside your midwife. Doulas and midwives actually make really great teams, and for the most part, doulas are welcomed by midwives because it means that some of the pressure to wear all the hats is off of them, and they can focus on doing all of the midwifey things like keeping you and your baby safe, which is kind of important. So there you go. Doulas and midwives have different roles in your birth space, but each play an important part in your birth team. And together they really provide full spectrum birth care, covering every aspect of your needs during your birth. And I've known midwives to say that they gladly welcome doulas to the birth team because it means that they can focus 100% on the many tasks they have during a birth. If you have any questions about the roles of a midwife or a doula, just pop them in the comments below and let's chat about it. Don't forget to grab your free printable birth affirmations from the link in the description so you can get into a great headspace before your birth. And these can also be used around your birth space as reminders that you're awesome. And if you're wondering whether you should hire a doula, whether they're worth the money, be sure to check out my video on doulas and the benefits they provide. If you want to know more about doulas or doula tips and tricks, make sure you subscribe and don't forget to hit that like button and share with anyone in your life who is pregnant or a new parent. Thanks for watching, and I'll see you on the flip side.